Hello, my name is Melissa Minix, and I'm going to be doing your complete adult assessment today. I've already went over your review of systems and went over the subjective data for that. Now we're going to be starting by doing your height and weight. How tall are you, sir?
6'1".
6'1", okay. Well, I'm going to have you step up on a scale. You care to step up there, sir? Okay. Okay, 275. You can step down now. Okay, and you had already emptied your bladder, so that's good. Now we're going to be checking your eyes. So I'm going to be having you read the Snellen chart over here. So what I want you to do is stand right over there. Okay. We're going to get one of those cards there. Okay. All right. So I want you, which line can you read there?
Probably 8, maybe 9.
Okay. Go ahead and read one of them.
D, E, F, P, O, T, E, C.
Okay. Now can you read with the other eye with it covered? There you go. And read backwards.
C, E, T, O, P, F, E, D.
Yes, very good. Okay. So come back over here. All right. And now the next thing we're going to be doing is doing your vital signs. I'm going to start by taking your pulse. I took your pulse for 30 seconds. I got 38, so your pulse is 76. And then I got your respirations at 20. Now we're going to be doing your blood pressure. Okay. And I got 126/82 for your blood pressure. Okay. So the next thing that I'm going to be doing is just looking at your head. Okay. I'm looking for the symmetry of your eyes and your ears. Okay. Everything looks good and symmetrical there. And now I'm going to be palpating your temporal artery up here. And I'm going to come down here and palpate your temporomandibular joint. So can you open your mouth for me? Good. Okay, good smooth movement. All right, and now I'm going to just be palpating your facial bones a little bit. Okay. Your frontal sinuses. Your maxillary sinuses. Okay. Now I'm going to be testing your cranial nerve 7, so I want you to clench your teeth for me. Show your teeth. Very good. And then I want you to raise your eyes like this. Wrinkle your forehead, good. Now I want you to squeeze your eyes shut. Okay. Can you smile for me? Okay. Can you stick out your tongue? Straight out, yeah. Okay, and then I want you to move it from side to side a little bit. Okay, very good. Okay, and then I want you to puff out your cheeks like you got air in them. Good. All right, now just assessing your skin. I want to assess the skin on your hands too. Okay, check your capillary refill. Okay. All right. The next thing that I'm going to be doing is looking at your head and palpating your scalp. Okay. Now, I'm going to be turning out the lights and I'm going to be looking at your eyes, okay? Turn out this main light. I think that'll be enough. So I want you to look straight at me. Okay. All right. Now this is checking your pupil response. Now, I want to ask you your full name.
Nathan Scott Minix.
Okay, and where are you at?
Home.
And what year is it?
2016.
Okay. So, good. Now, the next thing that I'm going to be doing is I'm going to be asking you some cognitive questions. I want you to finish the phrase for me. A cat is to a kitten as a dog is to a...
Puppy.
Okay. Then I have some arithmetic calculations for you. And what I want you to do is I want you to count back from 50 in intervals of 7 until you reach 8.
Okay. 50, 43, 36, 29, 22, 15, and 8.
Okay. Now I have a proverb for you, and with this proverb, I want you to tell me what it means. Okay? A bird in the hand is worth 2 in the bushes.
You're better off with what you have than what you could have.
Okay, very good. All right, the next thing I'm going to be doing now is assessing your ears. Okay? Looking for alignment. It's good. Their placement's good, and then I'm going to be palpating the auricles. Okay. That's good. Now I'm going to be putting an otoscope in your ear and looking inside your ear, okay? There we go, finally. Okay. Alright, I'm looking at the external auditory canal and the tympanic membrane in each ear. Come over here and look at the same thing. Okay, good. Alright. Now, I'm going to be doing what's called the whisper test. So you're going to hear me say 3 words behind you, and I want you to repeat the 3 words that I say, okay?
Fred, George, Martha.
Mm-hmm.
8, 12, 16.
Very good. Okay. The next thing that I'm going to be doing is called the Weber test. And I want you to tell me if you can if you can feel the vibration, hear the noise from both sides evenly, or if, hear from both sides evenly, or if you can just hear it from one side better than the other. Okay? Right.
Probably even.
Okay. All right, now I'm going to be doing this again, hitting this, making this vibrate again, and you're going to feel it on your mastoid process behind your ear. And then what I want you to do is tell me when you can no longer hear it there, and then I'm going to move it right beside your ear. Okay? And then you tell me when you can stop hearing it there.
Okay. 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 Okay.
Good. Okay. And then the next thing that I'm going to be doing is looking at your nose. It all looks good and symmetrical, no lesions. All right, now I'm going to be checking the patency of your nose. So I'm going to occlude your nose and make sure that you can breathe. Okay, over here. Okay. And now I want you to, and then I'm going to look in your nose first with this nasal speculum. Okay. And then over here. All right. And I was just looking at your nasal mucosa, your turbinates and your septum. They all look good. And now I'm going to be testing your cranial nerve 1 by having you smell 2 things, and I want you to tell me what you smell, but you have to close your eyes for this. Okay? So I'm going to occlude this first nostril over here, and you tell me what you smell out of the non-occluded nostril.
Alcohol of some sort.
Okay? Now we're going to be doing it with the other one.
Something citrusy.
Mm-hmm. Very good. Okay. Now I'm going to just be looking at your lips. Okay, and I'm going to put gloves on for this. Okay, palpating your lips. That all looks good. All right, now I'm going to be taking this pen light and looking inside your mouth. Okay, I'm looking at your buccal mucosa, your teeth, and your gums. Okay. So I want you to stick your tongue out. Let me look at your tongue. Okay. Now, I'm going to grab this tongue blade. And I'm going to use this, and when I do this, I want you to say "ah," okay?
Okay.
Good. Okay, so your uvula was midline and your soft palate and everything looked good back there. Now I'm going to be checking your gag reflex. Okay? So open up. Okay? Okay, good. All right. Now, your tonsils are also present, so you haven't had your tonsils removed. Now I'm going to be looking at your neck. Okay. Everything looks good and symmetrical. I don't see any lumps or pulsations. Now I want you to, I'm going to be looking at your range of motion of your neck. So I want you to touch your chin to your chest. And now I want you to hyperextend back. All right. And then I want you to lean your head to the side. Like, so come straight back up. Come straight back up. And lean your head to the side. Okay. And do the other. Very good. Okay. So now you're going to be doing this with resistance. I'll take this off. So I want you to try to push against my hand, not let me. Okay. Now I want you to do the same with leaning to the side. Okay. No. Yeah. Okay. Good. Now I want you to try to shrug your shoulders when I'm trying to add resistance. Good. Good musculature there. Okay. Now I'm going to be palpating your carotid artery. I'm going to do this one at a time. Okay. I'm going to come over here and palpate the other side. Good. Now I'm going to be palpating your superficial cervical nose down here, right here. Then I'm going to come in your posterior cervical, and I'm palpating your deep cervical right now. Okay. The next thing that I'm going to be doing is I'm going to be palpating your thyroid gland with a posterior approach. So I'm going to come behind you. Okay. Find your trachea here. All right. Now, swallow for me. Okay. You're going to feel me do this on the other side. Swallow for me. Good. Okay. Now we're going to be moving on to the upper extremities. So what I want you to do here is I want you to move your arms like this and then move them like that. I want to look at your range of motion. Okay, good. And then I want you to try to flex your elbow, but I'm going to try to provide resistance here. So try to bring your arm up with my resistance, okay? Now I want you to try to push it down. Okay, good. Same thing over here. Okay, try to, okay, good. All right, and I'm going to be assessing your pulses on both sides. This is your radial, okay, and your brachial. Okay, and now I'm going to palpate your epitrochlear nodes. the inside of your elbow. Okay, and over on this side, bend your elbow a little bit. Okay, good. The next thing that we're going to be doing is I'm going to have you lower your gown. All right, and I want you to turn that way. Okay. I'm looking at your back, your posterior chest, and looking at your thoracic shape. It all looks good. So I'm going to be starting your I'm going to do check your tactile fremitus. So what I want you to do is say 99 each time that I'm going to start up here, and I want you to say 99.
99.
Keep going.
99.
Mm-hmm.
99.
Okay.
99. 99. 99.
Okay, good. And then I'm going to percuss your systematically over your lung fields. So I'm going to start up here and percuss, okay? Okay. I'm inspecting your spine. And I'm going to palpate your spine, okay? Everything looks good there. All right. Then I'm going to percuss down it. Okay. And you're going to feel me touching your scapula over here. I'm just palpating it. All right, and I'm going to be checking for CVA tenderness to check your kidney tenderness. So if this hurts you, tell me, okay? Did that hurt? Okay. All right, now we're going to be looking at your lungs. So I want you to just take some good breaths for me. Okay, and now I'm checking for excursion. So breathe in, out for me. Breathe in, out. I'm checking thoracic expansion. All right. Now I'm going to be checking your diaphragmatic excursion, so I'm going to be percussing down your back, okay? Start right over here. Okay, right about there. Here's our tape. Now you're going to feel me doing the same thing on the other side. Right here. Okay. Okay. Okay, I'm going to be measuring. centimeters on both sides. Good. Now I'm going to be having you stay there, and I'm going to auscultate your lungs. So I want you to breathe in and out your mouth. Okay. Now I want you to turn around for me. Okay. Take some breaths for me. Okay. And now I'm just going to be palpating your chest wall a little bit. Okay. Good. All right, and I'm going to be finding the point of maximal impulse right here. Good. All right. I'm going to be checking along here at your lymph nodes. Okay. Can you raise your arm for me? Checking under your axilla. Okay, over here. Okay, and now I'm going to be percussing first and then auscultating your lung fields from the front. Okay, you can raise your training. Okay. Good. Okay, and over here. Good. All right, so the next thing that concludes the lungs. The next thing that we're going to be doing is looking at your jugular veins. So I want you to come over here and lay on the couch. I'll tell you that you're at a 45-degree angle.
Okay.
Okay, grab that gooseneck lamp. All right, can you turn your head that way? Thank you. Okay, a little bit more. Okay, good, I saw the 3 pulsations. So now we're going to be checking for the jugular venous pressure. Okay. There we go. Okay. So we'll take this and do that. Keep your head turned to the side, please. Okay. I got 8 centimeters. Good. Okay. So now I'm going to be having to get back up, and we're going to be having you sit on a bench, or lay on a bench rather. good. You want to lay this way. Okay. I'm going to be palpating the precordium. I'm going to start with your left apex. Okay. Palpate right here. All right, and then palpate across your right chest. Okay, good. Now I'm going to be auscultating, and I'm going to start with the aortic area over here. Going over to the pulmonic. The second pulmonic. The tricuspid. And now the mitral. Good. Everything look good there? Now we're moving on to your abdomen. I'm going to start by looking at the contour and the symmetry. Your skin and the umbilicus. Okay. I'm going to come up here and look down this way. Good. Everything looks good there. All right. Now I'm going to be auscultating for bowel sounds with the diaphragm. In all four quadrants. Okay. Good. That was good. Now I'm going to be taking the bell and auscultating for bruits and venous hums over the aorta to start with. The renal arteries. The iliac arteries. The femoral arteries. Okay, good. And now you're going to hear me, or feel me percussing in all your quadrants. I'm going to do this in a systematic approach. All right, and now I'm going to be percussing up your right midclavicular line and checking for your liver span. Right there. And grab some tape real quick. You got it marked for me? Thank you. Okay. And now I'm going to be coming down your chest. Right there. Okay. I'm going to be measuring your liver span. Okay. Got about 5 centimeters there. Okay. Now I'm going to be percussing across your midclavicular line over here to, or left axillary line to check for liver dullness, splenic dullness. Good. palpating, I'm going to be palpating in all 4 quadrants, okay? It's going to be a light palpation to start with. Does that feel okay? Okay, and you're going to be feeling me do a deeper palpation. Going to be deeper. Does that feel all right? All right. Now I'm going to be palpating for the liver. I feel my hand a little bit right underneath your rib cage. Okay. Good. And you're going to feel me do the same with your, take a deep breath when I do this. Okay. And then the same over here with the spleen. Okay. Now, I'm going to be checking your kidneys. So you're going to feel my hands underneath and above you. What I want you to do is take a deep breath. Okay, now release. Good. I'm going to be doing the same thing over here. Okay. Take a deep breath. Okay, release. Okay. Now, lastly, I'm going to be palpating for your aorta. Just going to feel me touching you. Okay. And now I'm going to be checking your abdominal reflexes. You're going to feel this just drag across you a little bit. Good. All right. We're going to be moving on to the feet and legs. So you can cover your chest up here now. And we're just going to be looking at the legs and feet. Okay. So, all right, I'm starting by looking at your skin characteristics and checking the temperature. You're going to feel me drag my hands across your legs. You got good warm temperature. And I'm going to be touching your ankle here to check for edema. Looks good. Okay, your hair distribution is good everywhere. You have good muscle mass, good muscle configuration. All that's good. So for your I'm going to be checking your range of motion now. So what I want you to do is I want you to take your toes and bend them straight. Or, yeah, take them straight down. Good. Now I want you to bring them back up. Good. Okay. And then I want you to flex your feet up, roll feet, and then flex your feet apart, down. Okay. Now I want you not moving your ankles. I want you to take your soles of your feet, like right here, and point them towards each other. Okay. Point them outward. Good. Now I want you to point your feet towards each other using your ankles. Okay, and then I want you to point them out, away from each other. Good. Okay. Then I want you to bend your leg at your knee, like raise your leg up with your knee. Okay? Same thing on the other leg. All right? Good. Now you're going to feel me touching your feet because I'm going to be checking your dorsalis medius pulses and your posterior tibial down here on each foot. Okay, you're going to feel me underneath your knee. I'm going to be checking your popliteal pulse. You can bend your leg a little bit. There you go. Okay, and then I want you to do the same on this leg. Good. Okay. All right, now I'm going to be checking your hips. So you're going to feel me touching your hips, okay? hips feel good. Good stability. All right. We're going to be doing some testing some of your range of motion here on your hips too. So I want you to bring your leg, bring this leg straight up in the air. Okay. Lower it. Bring the other leg straight up in the air. Okay. You can lower it. Then I want you to bring this knee up towards your chest. Okay. You can lower that. Now bring the other knee straight up towards your chest. Good. Now what I want you to do is I want you to swing this leg out towards me, okay? And now swing the other leg out the other way. Good. Okay. Then I want you to take your leg, this leg here, put your foot, your heel on your knee, and kind of rotate your leg out a little bit. Okay, good. Do the same thing to the other one. Good. Good range of motion. All right, so now I'm going to be having you raise up off the bench. Okay, I'll help you a little bit because that's hard to raise straight up the bench like that. Okay, and you're going to be in the seated position. Okay, facing the camera. All right. And remove this back a little bit since we're not in the seated position anymore. Okay. So the first thing I'm going to be doing, I'm going to be checking your neurological function, so I'm going to be testing you with a broken tongue blade. So what I want you to do is when you feel the sharp, you're going to have your eyes closed. When you feel it sharp, I want you to say sharp. When you feel it dull, I want you to say dull, okay?
Sharp. Dull. Dull. Dull.
Okay. Keep your eyes closed.
Sharp. Dull. Sharp. Dull.
Okay. And on your lower arms, you're going to feel it down here.
Sharp. Dull. Sharp. Dull.
Okay, and I'm going to be checking down here, okay?
Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Good. All right, and then we're going to be doing what's called the 2-point discrimination. So I want you to tell me, you're going to keep your eyes closed, that's good. I want you to tell me when you can, if it's 2 points or 1 point of the safety, or this paper clip touching you, okay?
2. 2. 2. 1.
1. Good. Okay. Got about 1.5 centimeters. Okay, and now the next thing that I'm going to be doing is testing your fine motor coordination. So what I want you to do is with your eyes closed still, go ahead and close them. I want you to extend your arms out all the way to your sides like you're spread eagle. Okay, and I want you to take your arm, or take your finger and touch your nose. The other one. And I want you to do that in repetition with increased speed. With your arms totally extended. Yeah. Okay, good. All right. And now I want you to touch each finger, like each of your fingers with your thumb on each hand. Good. Okay, and now I want you to touch your nose and touch my finger in repetition. Okay, good. And now I want you to take your heel and run it up your shin from your foot. Yeah. The other one. Good. Well, that was pretty good. All right. Now I want you to close your eyes, and I want you to tell me what position that I have put your toe in. Start with your toes, and then we're going to go to your fingers, okay? So, actually, we'll just raise this up so that they can see. We'll bring the stool over here. Okay, put it on there. Okay, and you close your eyes.
Down. Up. Up. Down. Down.
Good. Okay, you can lower that now. Okay. So we'll check your fingers now.
Okay.
Okay. Your eyes closed? Yep.
Down. Up. Up. Down. Down.
Okay, good. All right, now we're going to be checking your deep tendon reflexes. So I'm going to get the reflex hammer and be checking it. It's right over here. Okay, we're going to start at your brachial.
Okay.
Okay. So bend your arm like this. Okay, gonna go over here. Okay, now we're gonna do the brachioradialis. The brachioradialis. Okay. Right here. I'm gonna be right here. Okay. I'm going to shrink your tricep back here. So I want you to take your arm like this, hang it. Okay. Get over here. Okay, good. All right, now we're going to be moving on to your patellar. So I'm going to hold your leg and I want you to leave it kind of dangling. Good. Actually, it's hard to see that in. I might move it down here. Okay. Over here. Okay, good. So now we're going to be checking your Achilles. Good. Checking your other Achilles. Okay, good. And that was the Achilles tendon. And now we're going to be checking your plantar reflex. So we can bring this back up here, actually. We're going to put your foot on the stool for this. Good. Now your other foot. Good. Okay. So all those were good. Now I'm going to be having you stand. Move some stuff over here. Okay, and I want you to turn with your back to the back to the camera. I'm going to be palpating your spine here. Does that feel okay?
Mm-hmm.
Okay, now what I want you to do is I want you to bend over Bend forward at the waist and touch your toes as much as you can. You can take that off. Good. All right. Go ahead and keep bent over like that. I'm looking at your curvature. Now I want you to come back and I want you to hyperextend. Good. Okay. Then I want you to, you can face the camera now. Now I want you to bend from side to side at the waist. Good. Other way. Okay. And I want you to twist your body this way and then twist your body the other way. Good. Okay. That was good. All right. Now we're going to be just looking at your neurological gait. So I'm going to watch you walk actually. So I want you to stand back here.
Okay.
And I'm going to be watching you walk over there to that couch and back, okay? Come back. Very good. So now I'm going to be doing the Romberg test on you. So stand up just here, just a little bit more. There you go. So I want you to have your feet together, your arms at your side, close your eyes. And I'll catch you if you fall. Okay. Good. You did very well. Okay, now I want you to open your eyes, and I want you to walk to that couch, the same couch you just walked to. Wait. With your heel to toe like this. Yeah. Very good. All right. Now what I want you to do is I want you to close your eyes. I want you to move up just a little bit so they see. I want you to close your eyes and stand on one foot. Okay. Good. Other one. Okay. Very good. Now I want you to hop on one foot. Good. Hop on the other foot. Good. All right, you did very well, and that concludes our adult assessment today. Thank you.